You know, October is National Breast Cancer Awareness Month. And so today we're talking to Dr. John Bailey, who is a nationally recognized breast surgeon. And we're going to talk about statistics and a special Singing River Health System is doing right now. Matter of fact, this is it. $80 for a mammogram. They're offering through November the 21st with Singing River Health System. So let's talk about, if you would, Dr. Bailey, 1 in 8 women over the course of a lifetime will develop breast cancer.
Yes, sir.
192,000 a year are diagnosed with breast cancer. And this is like close to almost like skin cancer, but that women deal with.
This is certainly one of the most common cancers that we see. Unfortunately, it is a very common disease. There'll be a few hundred women on the Mississippi coast diagnosed with breast cancer every year.
Wow.
And we have developed here through our practice a breast center. I became certified in breast ultrasound and breast stereotactic biopsy procedures through the American Society of Breast Surgeons a few years ago. Mm-hmm. And so we have been able to offer these procedures to our patients in order to make it easier to make these diagnoses and to speed the process of getting them treated appropriately for their breast cancer as they come up. We also do a lot of work with benign breast disease because there is an overlap on mammography and ultrasound as to what looks like cancer or not like cancer, and so a lot of the things that we deal with also turn out, fortunately, not to be cancer when we do biopsies. And so we see patients for a wide range of breast diseases and breast problems.
And technology has come so far ahead over recent years in helping you diagnose what is
it has
benign, what is malignant, necessary, and you can basically do it right in the office.
That is correct. The technology in radiology has advanced tremendously over the last few years. We have digital mammography, mm-hmm. We have better ultrasound machines, we have breast MRI that's available to us as well to help distinguish between cancer and non-cancer, hopefully in many cases before we do a biopsy. But yes, in the office, when a patient comes to see us, we are able to do ultrasound-guided biopsies in the office of either solid masses, which we're concerned about cancer, or in many cases, it can be a benign cyst, such as in fibrocystic disease, but it's a painful mass to the patient, and we're able to drain that fluid and make the pain go away instantly. And so that's part of the beauty of this, is that they can come in and often within 30 minutes we have done the procedure and they're headed home, and hopefully by the next day we'll know what the result is.
Oh, that's awesome. And that way it does, because used to 10 years ago, 15 years ago, and I dealt with this personally, and they do the biopsy, do the test, and then there's that wait.
That's
you
correct.
Have that wait, and I know that it's so unnerving for a woman to have to wait and find out exactly what it is. I mean, you see the commercial on TV where the doctor is just told this woman, you have breast cancer, and she's just sitting there, and it's almost like the whole world goes out of focus.
That's correct, and it's hard for the patient, and it is also very difficult for their family members and their friends who come to see me with the patient. Mm-hmm. Everybody wants to know right away what the problem is and what are we going to do about it, and that's what we try to do, is to get that process going as quickly as possible.
Talk about what is BRCA testing? I mean, this is something that Angelina Jolie, a few years ago,
correct,
went in and had this test done and found out she had a mastectomy, and because she. Explain that if you would.
So the BRCA gene there are 2 genes actually, and they have, when a person has that mutation, mm-hmm. it then increases their chances of having breast cancer in the neighborhood of about 80 to 90% over their lifetime. And so in Angelina Jolie's case, she did not have cancer. She had this gene. She chose to have bilateral mastectomies to prevent breast cancer. And we have had patients like that in this area as well. We offer genetic testing through our office. We don't do the testing at the office, but we draw the samples mm-hmm. to send to an outside lab to be tested. And in addition to those 2 genes, we actually test for a total of 25 genes, because there is, in many instances, an overlap of genetic mutations that cause breast cancer and also cause other cancers, such as colon cancer or prostate cancer or pancreatic cancer. And so we have probably, in our practice in the last year, found 10 to 12 patients who had these genetic mutations, and it changes the way that we treat them. And particularly when it's not just a breast cancer gene, but for instance, if they have a gene that increases their risk of colon cancer, at a young age, we're going to start colonoscopy and hopefully prevent that as well.
Now, we've always heard that it's kind of generation thing that if your mother had it, her sister had it, something like that, there's a very high chance that you could have that. That
is correct.
Could have it. But also, 85%. That's a pretty high percentage of women that has no background history in their family.
That is
possibility that they could have it.
Yes, it is, and that is that's the most daunting part of this, is that we have to see those patients, do enough digging into their family history to find out that they need this done, because we often test patients who don't have cancer. It's purely based on their family history. And so if there are enough relatives of the appropriate ages or close enough relatives, then that patient often needs to be tested. Now there's a certain set of criteria that we have to go through, but those are the ones we want to catch. We want to catch them before they have the cancer.
Right, exactly.
And get rid of this before it ever becoms a problem.
What's the early age, for those that do have it running in the family, what's a good early age to start having mammograms?
The key things to look for, start having mammograms, we recommend still a baseline at age 35. Now, if the patient's family has a significant family history of breast cancer, we occasionally will do it a little earlier than that. But 35 is pretty much the baseline, and then starting at age 40 on an annual basis. There's a lot of controversy in the medical literature about the validity and value of mammography in younger age patients, and also in older age patients for that matter. But I still believe it's very helpful and very beneficial, and I strongly support getting annual mammography after age 40.
Well, again, we've got just almost about a minute left, so we're going to talk again real quickly about this special that they have going on here with the Singing River Health System. $80 mammogram now through November 21st. There's no better time to take care of yourself. The Singing River Health System is offering you an $80 digital screening, which includes the mammogram, computer-aided detection, and radiologist reading. That's correct. So it is a flat rate for the procedure and for the interpretation to get you a report from the radiologist. So there is no additional charge on the top of that 80. Okay, and the fact you call the number on your screen. There's 3 different locations: Ocean Springs, Medical Park here, Pascagoula, and I guess North Bay Diagnostics in Biloxi. Correct. So we cover the east end of the coast completely. All right. Thank you so much, Dr. Bailey.
Hey, I appreciate it.
If you'd like some more information about this, number is on your screen. Call and make your appointment. This is National Breast Cancer Awareness Month. Catching it early could definitely save a life. So give them a call, and hopefully we'll save your life too.